Hello, this is Dr. Jerry Cuomo. We're back here with Margarita's case. We want to just show you how now we can backfill these little chimney holes here that allowed us to make the case a screw retain case, a successful screw retain case. Straightforward. The surgeon did a nice job placing the implants in the proper position, and they do use a surgical stent. So here we go. Now we're going to add our Teflon tape, but even before that we'll go ahead and add, let's get the Teflon in there first and then we'll add the adhesive to the top. So we've adjusted about her bite, and now the next step is to let's put something to cover up these holes. So there's our tape. Okay. Now we need a smaller condenser, periodontal probe. Okay. So there it goes. Look at how that just tucks all the way in beautifully. Now you want to put enough of this material in there, but you want to condense it. You don't want really trap any air. So we're going to go ahead and condense that. Here comes my other piece. Again, I'm just literally tucking that one in. See if I can use that perio probe again. There we go. Push, push, push. That goes all the way in like so. I mean, I used to just put a little at a time. Now I know that these things, they do take some space. And it's nice, it's condensable. That's what you want. There we go. And I just go in a counterclockwise or a clockwise way. Just walk it around. Push, push, push. Margarita, I'm just pushing a little bit. I'm going to protect the screws that cover your implants, and those will always be protected. If God forbid we ever had to go back in for any reason, we have the ability to do it without hurting those most important screw heads that are in there. I might go with just a little bit more for this mesial. So just not much more. Just again, Teflon tape, easy to remove too, by the way. You can use an Explorer to remove it if you had to. Alright, open up just a hair more. Great, thanks. Alright, this is what I wanted to do. Condense just a little bit more. I've changed from cement retain to screw retain. Now it's pretty close to 95% of the time to 99% of the time I'm going to use screw retain. Alright, now we're going to place, we've already etched the zirconia, and I guess we're just going to use our silane material that comes with this paracord. It's an etch primer bond all in one. I'll just use that. And now we're good to go. Oh, little suction. You okay? All right. Do you need a little water at all? You okay? Okay. We're just waiting about 30 seconds for this to take effect. And now we'll lower the light. Here's our bonding agent. And that just gets applied, and then we'll dry that. And we'll time it. 30 seconds, let it soak. This 3-tooth bridge is replacing an older bridge that did fail because of recurrent caries, and Now this side will be most secure for her. The paracord comes in 2 shades. I like to finish it with a whiter shade, so I'm going to put the Denton shade in there. Let's just see if Denton is our main color. I seem to be out of this material. Let's see. Oh, here it comes. Actually, that should be fine. That's perfect color. I'll wipe that. Again, I keep the tip submerged. Let it overlap a little bit with the occlusal. Then we'll light cure it. And simple polish after that. Just wanted you to see this this step, just a step-by-step process. And by the way, it only took me, I want to say roughly 5 minutes to adjust her bite and to polish. So the mounting was quite accurate. We did have a posterior stop to get the model work done, but the turnaround on this case was great. And we're very comfortable in seating it. So don't forget to fit check your cases. It's important. Don't leave it totally up to your lab. Fit checking is, the buck stops with you. And unless you're doing that with every case, you're going to use up some very important chair time, which is going to waste your patient's time, and they don't want to stay in a chair too long as much as you don't want to. So fit check your cases, and if you haven't yet observed the fit checking video, it is now up. I did an updated version for all to look at and to review and to learn from. Alright, I think we're almost good to go here. So my next steps are now just to adjust out her bite one more time. I don't need to show you that, but did want you to just take a look at this material from Whale Dent, Coltine Whale Dent. Blends in beautifully. This is under a high power microscope, and that color is just exquisite. For the upper posterior, who's going to see it except your hygienist and you, unless you're taking video or photography. But this is, it is a beautiful case, and we're very proud of it. And sister, is there anything you want to say? No? Adjusted, she's happy. So see you next time. Take care.